Examiner Torith Vasani woke to the cadaver alarm. Not the gentle pulse of a scheduled intake, not the slow three-tone chime of a body transferred between departments. This was the staccato double beat that meant something irregular had arrived in her bay, something the intake system could not classify, and therefore something that required her hands before it required her instruments. She was upright and moving before her second eyelid had finished retracting. 31 years in the moratory division of the Keth Dominion Surgical Collegium had trained the grogginess out of her the way a river trains stone. Slowly, then completely. Her bare feet hit the cold tile of her quarters, and she was pulling her examination coat from the hook before she had drawn her third breath. The coat was stiff with use, bleached by the bay's sterilization lamps to a pale gray that had once been dark blue. She fastened it without looking. By the time she reached the corridor, she was an examiner before she was fully awake. The Collegium's moratory wing occupied the lowest level of the surgical complex, a long, bright hall of examination bays separated by optical crystal partitions that allowed light to pass freely while containing biological material. The overhead panels flooded every surface with the blue-white spectrum the Keth preferred for tissue discrimination, daylight calibrated, shadowless, the kind of light that hid nothing. Torith had spent more of her adult life under these panels than under open sky. The light was not warm, it was not cold. It was honest, and that was enough. 2 junior examiners, Dreth and Solani, were already at the intake slab in Bay 7. Their four-fingered hands hovered over the draped form that lay between them. Neither was touching it. Neither was speaking. That was the first wrong thing. Junior examiners talked constantly during intake cross-referencing species markers, calling out visible trauma, asking each other whether the liver equivalent was left lateral or mid-ventral. Silence meant they had encountered something outside their training. "Report," Torith said. Dreth looked up. His secondary eyes were dilated, which meant stress. His primary eyes were locked on the draped form, which meant he could not look away from it. Female, Terran. Age estimated between local equivalent 70 and 80 standard years. Cause of death appears cardiopulmonary, non-traumatic. The body was transferred from the Terran consular annex 20 minutes ago with a diplomatic flag and a succession note. "Succession note," Torith repeated. "A legal document," Solani said. She was younger, less seasoned, and her voice carried the particular flatness of someone suppressing confusion. "It designates this office as the receiving authority for the body and requests a full post-mortem with emphasis on the hands." "Emphasis on the hands," Torith said. She had not meant to echo them. It was the kind of verbal tic she corrected in students, but the request was without precedent in her career. Postmortems in the Collegium followed protocols that examined systems in descending order of diagnostic yield: neural, cardiovascular, respiratory, musculoskeletal. The hands were part of the musculoskeletal review. They were not singled out. They were not emphasized. Unless the hands were the point. Torith stepped to the slab and pulled the drape back. The human woman beneath it was small by Terran standards. Narrow shoulders, thin frame, the kind that had been useful once and had spent its final decades becoming less so. Her face was lined but composed, eyes closed, lips slightly parted, gray hair cropped close enough to show the shape of the skull beneath. No surgical implants visible at the surface, no scarring consistent with augmentation, no dermal modifications, no jewelry. An unmodified Terran female. Then Torith looked at the hands. They were resting at the woman's sides, palms down, fingers slightly curled in the relaxed posture of recent death. Small hands, thin-boned, the kind a Terran might describe as delicate, though Torith had learned early in her career that the word was misleading when applied to humans. Their hands were the most complex manipulative structures in the known biosphere: 27 bones, 34 muscles, an architecture of tendons and ligaments, so intricate that the Collegium's prosthetics division had failed to replicate it in 3 centuries of trying. But the scars. Torith bent closer. Her primary and secondary visual fields merged as she narrowed her focus, and what she saw made her pull a magnification sleeve from the instrument tray and fit it over her dominant eye without conscious thought. Across the dorsal surface of each hand, traversing the knuckles in precise parallel lines, were scars. Surgical scars. Not the rough, uneven marks of injury, not the broad, flat signatures of corrective reconstruction. These were deliberate. Micro-incisions healed clean, spaced at intervals so exact they could have been measured with a micrometer. Each one ran perpendicular to the metacarpal bones, crossing the extensor tendons at their thinnest point. Torith counted. Left hand 14. Right hand 17. 31 scars in total. 31 deliberate incisions into the most complex manual structures in the known biosphere. She straightened. Dreth, pull the file the consulate attached. Everything they sent, the succession note, professional records, annex documents. I want it on screen now. The file arrived in segments. The first was the succession note itself, a legal instrument written in formal Terran diplomatic language that Torith had to run through the Collegium's translator twice before she trusted it. The core directive was clear. It designated the Keth Dominion's Moratory Division as the repository for the deceased's professional record. Not her personal effects, not her estate, her professional record. The woman's name was Dr. Leanne Astrove, Terran, born on a mid-belt colony called Brevery. Surgical specialization, xenoneurology, the practice of operating on non-human nervous systems using human hands. Torith read that designation 3 times. Then she read the career summary beneath it. 52 years of active practice. Over 600 procedures on alien patients across 11 species, including the Keth. Spinal decompressions on Vrelian patients whose nerve columns ran in triple parallel and tolerated 0 lateral deviation. A displacement of half a hair's width during surgery could cause permanent paralysis. Cortical remappings on Salesi, whose brain tissue calcified if exposed to air for more than 90 seconds, requiring the surgeon to work blind inside a sealed cranial cavity by touch alone. Neural sheath repairs on Torith's own species, the Keth, whose nerve fibers were woven into a lattice so fine that a single misplaced cut could unravel motor function across an entire limb. Cardiac-adjacent nerve rerouting on Metheli, whose heart sat nested inside a cage of sensory nerves so dense that the slightest surgical contact with the wrong fiber could stop the organ mid-beat. Sensory trunk splicing on Drenari, whose autonomic nervous systems ran through bone rather than alongside it, requiring the surgeon to drill through living skeletal tissue with tolerances measured in hundredths of a millimeter. And the success rate. Torith looked at the number and then looked at it again. She pulled the magnification sleeve off her eye because she wanted to be certain the lens was not distorting the display. 99.7%. 612 procedures across 11 species. 2 patients who had not survived. The Collegium's own best xenosurgeons, 300-year veterans with instruments designed for their anatomy, maintained a success rate of 94% on Keth patients alone. Astrove had outperformed them by 5.5 points across 11 different species, with hands that had not been designed for any of them. Examiner, Solani said from behind her. The second file segment is loading. It's extensive. Let it load, Torith said. She had not looked away from the hands. Because now she understood what the scars were. Now the spacing made sense, and the precision, and the number. Torith felt her crest flatten against her skull, an involuntary response her species associated with reverence, or with fear. She could not tell which one was firing. The 2 sensations shared the same autonomic pathway. Each scar was a surgical modification Dr. Astrove had performed on herself. The files confirmed it. Attached to the career summary was a self-modification log, maintained in Astrov's own hand, dated and annotated with the clinical detachment of someone documenting an experiment on a test subject who happened to share her body. The log was chronological. It began 51 years before her death and ended 3 years before it. Entry 1, dated 51 years before death. Bilateral extensor tendon release, 2nd and 3rd metacarpal junctions, left hand. Purpose: to increase lateral flexibility of the index and middle fingers by 0.3 degrees beyond natural human range. Performed under local anesthesia, self-administered using a mirror rig and a microscalpel designed for Vrelian nerve work. Recovery time: 11 days. Result: successful. Flexibility gain confirmed at 0.4 degrees. Torith read the entry and felt her secondary stomachs constrict. She had performed self-modifications to her own hands with alien instruments under local anesthesia, alone, using a mirror, at age 26, to reach an alien's nerves. Entry 2, 9 months later. Tendon sheath microscoring, 4th and 5th metacarpal bridges, right hand. Purpose: to reduce involuntary tremor amplitude below the threshold detectable by bequeathed nerve lattice fibers. The bequeathed lattice responds to vibrations above 0.02 millimeters. Anything above that threshold during surgery causes the fibers to retract defensively, turning a repair into a cascade failure. Human baseline hand tremor runs between 0.04 and 0.08 millimeters. Astrov's hands, after the modification, measured 0.015. She had cut into her own tendon to stop her hands from shaking enough to damage Torith's own species. Entry 3, ligamentous shortening, scapholunate interval, left wrist. Purpose: to stiffen the wrist joint by 2 degrees of freedom, sacrificing range of motion in daily tasks in exchange for absolute stability during the pronated grip position required for Vrelian spinal approaches. The trade was permanent. She could no longer bend her left wrist fully backward. She could, however, hold a scalpel motionless inside a Vrelian nerve column for 11 hours without deviation. Entry 4, subcutaneous adipose reduction, thenar and hypothenar eminences, both hands. Purpose: to reduce the thickness of the palm pads by 1.2 millimeters, allowing her fingers to fit inside the surgical access ports designed for xenosurgeon hands, which were thinner than human hands by exactly that margin. She had not asked the xenosurgeon to redesign their ports. She had redesigned her hands. Torith scrolled through entries 5, 6, 7, 8. Every entry followed the same architecture. A species, a problem, a limitation of human anatomy that made operating on that species dangerous or impossible, and then the self-inflicted, self-designed, self-performed modification that removed the limitation, purchased in pain, in recovery time, and in the permanent alteration of her own body. Entry 9, subdermal nerve relocation, thenar eminence, right hand. Moved the median nerve branch 3 millimeters lateral to prevent compression during prolonged operations on xenosurgeon calcifying tissue. The xenosurgeon surgical window was 90 seconds. Astrov needed her thumb to hold position for the full duration without the pins and needles onset that human median nerve compression caused after 60 seconds, so she moved the nerve. The procedure took 40 minutes. She performed it in her quarters on a desk, with a borrowed xenosurgeon collagen thread suture kit and a dental mirror. Entry 11, bilateral interosseous membrane stiffening between the 3rd and 4th metacarpals, both hands. She had injected methyl cartilage bonding compound into the membrane to create a rigid bridge between the two bones, eliminating the slight independent play that all human hands exhibit between the middle and ring fingers. The play was normally invisible less than 1/4 of a millimeter. But during methyl cardiac nerve procedures, where the surgical field sat inside a cage of sensory fibers spaced at intervals of 0.3 millimeters, 1/4 millimeter of uncontrolled play was the difference between a successful rerouting and a stopped heart. The bonding was permanent. Her middle and ring fingers moved as a single unit thereafter. She noted in the log that she had difficulty using standard Terran eating utensils for 3 weeks after the procedure. Entry 14. Flexor retinaculum partial release, left hand. Created a controlled microinstability in the wrist joint to allow the hand to rotate 11 degrees past the natural human supination limit, necessary for reaching the posterior nerve trunk of a drenari patient without repositioning the body. The drenari could not be repositioned during neural procedures because their autonomic system interpreted positional change as a predator attack and triggered immediate cardiac arrest. Every other surgeon built articulated instruments to work around this. Astrov had calculated their failure rate 3.1%, caused by mechanical lag in the articulation joints, and decided that the failure rate was unacceptable, so she had modified her wrist instead. Her failure rate on drenari posterior trunk procedures, 0. Entry 17. Digital artery microsplinting, index finger right hand. Restricted blood flow oscillation in the fingertip to dampen the pulse-synchronous microtremor that all human hands exhibit, the faint throb of the heartbeat transmitted through the arteries, causing a rhythmic displacement of approximately 0.01 millimeters. For most surgical work, this was irrelevant. For bequeathed neural lattice repair, where the fibers responded to vibrations above 0.02 millimeters, and the accumulated effect of pulse tremor over an 11-hour procedure could push the aggregate displacement above that threshold. It was not. The splint was internal, a cage of bequeathed lattice bonding compound, the same material the collegium used to stabilize nerve fibers during reconstruction, repurposed to stabilize a human fingertip. She had used their own material inside her own hand to operate on them. Entry 22. Bilateral digital nerve transection and rerouting, ring fingers, both hands. Sacrificed sensation in both ring fingers permanently to eliminate a feedback loop that caused involuntary grip tightening during high-stress fine motor operations. The feedback loop was a human survival reflex under stress. The hand grips harder. In xenoneurological surgery, that involuntary tightening could crush tissue measured in microns. Astrov severed the sensory nerves and rerouted the motor pathways to bypass the reflex arc. Her ring fingers could still move. They could still grip, flex, and hold a scalpel with sub-millimeter precision, but she could not feel them doing it. She had traded feeling for control. The postoperative note read, sensation loss confirmed bilateral, motor function intact, grip reflex eliminated. Note, dropped a cup of water this morning because I could not feel my ring fingers grip on the handle, compensated by adjusting hand position. Acceptable trade. Entry 26. Proprioceptive nerve dampening, thumb and index finger left hand. Reduced the hand's ability to sense its own position in space by 40%, eliminating an overcorrection reflex that occurred during operations where the surgical field was deeper than the human arm's comfortable range. At full extension inside bequeathed limb tissue, the human proprioceptive system sent alarm signals that manifested as involuntary microadjustments. Astrov dampened the alarm. Her left hand no longer knew with its former precision where it was in space. She compensated with visual tracking. She noted that she occasionally misjudged the position of door handles in the dark. Entry 29. Tendon length redistribution, all 5 digits right hand. Short the flexor tendons of the index and middle fingers by 0.8 millimeters each, while lengthening those of the ring and little fingers by the same amount, creating a grip profile that more closely matched the Vrelian surgeon's hand, the hand that Vrelian surgical instruments had been designed for. Her right hand could hold Vrelian instruments at their designed grip angle without compensatory wrist rotation. It also meant her right hand's natural resting grip was visibly asymmetric. She noted this as a cosmetic effect with no functional impact. Torith set the magnification sleeve down. It made a small click against the metal tray. Examiner, Dreth asked from the far side of the slab. She modified herself 31 times, Toreth said. Over 51 years, every modification made her hands more capable of operating on us, on species that were not her own. She paused. She paid for every modification with a permanent loss of normal function, range of motion, sensation, comfort, proprioception. She paid for it alone in her quarters, with borrowed instruments and alien suture material, because no human hospital would have approved the elective reduction of a surgeon's own capabilities. The third file segment loaded. It was the succession notes operative clause. Dr. Leanne Astrove had left her hands to the Keth Dominion. Not metaphorically. She had filed a legal instrument designating her hands, both of them, from the wrist joint distally, including all tissue, bone, tendon, nerve, and modification material, as a bequest to the moratory division of the Keth Surgical Collegium. She had done it 14 years before her death. The instrument was notarized, witnessed by the consular attaché and by a member of the Collegium's own ethics board. The hands were to be preserved using the Collegium's tissue fixation methods. They were to be studied. Every modification was to be documented and added to the xenosurgical training archive. And then the hands were to be displayed. Not in a museum. In the primary surgical theater of the Collegium, above the scrub station, where every surgeon would see them before every procedure. Palms down, scars visible. The note's final paragraph read, "These hands were not exceptional by Terran standards. They were small, thin-boned, and prone to the tremor common in all human fine motor systems. Every modification documented in the attached log was performed to overcome a limitation of my species' anatomy that would have endangered a patient of another species. I was not gifted. I was not augmented. I was not the product of genetic selection or cybernetic enhancement. I was a human being who decided, 31 times over 51 years, that the distance between what my hands could do and what my patients needed them to do was a distance I was willing to cross at my own cost. I leave them here so that the surgeons of the Collegium may see what ordinary hands can become when the person behind them refuses to accept the word impossible as a limitation rather than an engineering problem. L. Astrove." Toreth read the paragraph twice. Then she turned off the document reader and stood in the bright light of the examination bay, looking at the hands. They were not beautiful. They were scarred, thin, slightly gnarled by age and by the cumulative toll of 31 self-inflicted surgeries. Small hands, ordinary by every metric the Collegium used. Except for what they had done. "Examiner," Solani said, "the succession note, are we obligated to comply? It carries diplomatic weight, binding under the accord." "I meant, should we?" Toreth looked at her. The question was not about obligation. It was about whether the Collegium, 3 centuries of tradition built on the assumption that each species' hands were designed for its own patients, could accept an inheritance from a species it had never trained. "Begin the full post-mortem," Toreth said. "Standard protocol, but when we reach the hands I will perform that examination personally." She had never said that before, in 31 years, but these were not ordinary hands. It was a succession. The post-mortem took 14 hours. Toreth worked through the standard systems first. The neural examination revealed a healthy brain with age-appropriate deterioration, but the motor cortex was unusually developed, the pathways thickened by decades of precision work. The cardiovascular system confirmed a catastrophic arrhythmia, sudden, almost certainly painless. The heart had simply stopped. The musculoskeletal review showed joint degeneration in the knees and spine from decades at operating tables, mild osteoporosis, muscle atrophy below the waist. The body of someone who had lived entirely through her hands. Then she reached the hands. She cleared the juniors from the slab. She began with the left hand. The first scar was 51 years old. The tissue had healed perfectly. Torth traced it with a probe and activated the deep tissue imager. The extensor tendon had been partially released, allowed to slide laterally by less than a millimeter, and re-anchored with Vrelian nerve silk still translucent, still intact after 5 decades. She documented the finding and moved to the second scar. By the 6th hour, she had mapped all 31 modifications. She had imaged each one at 3 resolutions, identified the suture materials Vrelian nerve silk, Salesi collagen thread, Keth lattice bonding compound, Drenari cartilage anchors, Methali bioadhesive, and cross-referenced each with the log. Every scar matched an entry, every entry matched a species. And then Torth found the 32nd scar. It was on the right hand, between the 4th and 5th metacarpals, in a location the log did not reference. It was newer, 2 or 3 years old. The incision line was slightly less precise, and Torth understood why. Astrov's hands had been 75 when she made this cut. The modifications that had eliminated her tremor decades ago were fighting time, and time was winning. Torth imaged the site. Beneath the skin, sutured to the interosseous membrane with a knot so small it was invisible without magnification, was a flat object no larger than a grain of stone wheat, encased in Keth medical-grade containment material. Torth extracted it with forceps and held it under the magnification sleeve. A data crystal, Keth manufacture. The specific type, the collegium, used for archiving surgical technique recordings. Astrov had sewn a Keth teaching crystal into her own hand. Torth placed it in the reader. 412 surgical technique files, each a complete step-by-step recording of a xenoneurological procedure. Camera angles showed the approach. Instrument selections were annotated in Astrov's handwriting. Decision points were flagged with margin notes that read like a teacher speaking to a student who had not yet arrived. Here the tissue feels harder than expected. Adjust depth by 0.3. Do not trust the scan. Trust the hand. Contingencies were mapped. Failure modes were documented, including the 2 procedures that resulted in patient death, annotated with the same precision as the successes, and with something Torth could only describe as grief held at arm's length. 412 procedures, 11 species, 52 years of work. A surgical textbook written in practice. Astrov had sewn it into her own hand, beneath a scar indistinguishable from the others, knowing the collegium's post-mortem would find it, knowing the examiner would count the scars, would find one that did not match the log, would look deeper. The last file on the crystal was not a surgical recording. It was a text document dated 3 years before death. To the examiner who finds this, the succession note gives you the hands. This gives you the work. The hands without the work are anatomy. The work without the hands is theory. Together they are a curriculum. I modified myself 31 times because each time I was faced with a patient whose body my hands were not built to save, and I chose the patient over my hands. I do not know if what I did was wise. I know it was necessary, and I know it worked, and I know the knowledge should not die with me. Teach it. L.A. Torth set the crystal down on the instrument tray. It made a small, clear sound in the quiet bay. She stood for a long time in the bright, honest light. Then she placed the crystal in the archival case, reserved for evidence of the highest classification. She sealed it and labeled it in formal Keth script, with the designation, the collegium reserved for materials deemed essential to the advancement of surgical practice. She called Dreth and Solani back. The succession note is binding. The hands will be preserved, studied, and displayed above the scrub station in the primary theater, as specified. The faculty will need to approve, Dreth said. There is no precedent for mounting non-Keth biological material in a collegium theater. I will present the findings. The modification log, the technique archive, the crystal she sewed into her own hand, and the patient outcomes. The outcomes, Dreth repeated. 99.7% across 11 species. 0 Keth losses in 67 procedures over 39 years. Our own surgeons lost 11 Keth patients to lattice complications in the same period. Torith paused. I will let the numbers speak. There is also the crystal's final file, Torith said. She asked that we teach what she learned. Solani looked at the hands, then at Torith. Will we? Torith thought about the Collegium's 300-year veterans, its instruments designed for Keth anatomy, its 94% rate. She thought about a young woman in a mid-belt colony who had looked at the distance between her hands and the patients who needed them and decided, 31 times, that the distance was not a wall but a problem to be solved. We will do more than teach it, Torith said. We will adopt it. She filed the post-mortem under the classification reserved for findings that altered standing collegium doctrine, a classification used fewer than 40 times in 300 years. Dreth approached her as she completed the final documentation. He had been quiet for most of the examination, which was unlike him. Examiner, I looked up Astrov's patient records, the Keth patients. How many? 67 over 39 years, he paused. The records include post-operative notes. Astrov wrote them herself. They are not what I expected. He pulled up a note from 12 years before death. A Keth male, age 60, nerve lattice degradation in the left forelimb. Full lattice reconstruction, 7 hours. Hands at tremor amplitude below 0.02 millimeters the entire duration. Postoperative note, patient stable. Lattice integrity restored to pre-degradation baseline. Full motor function expected within 60 days. Note, left ring finger numbness worsening, compensating with visual feedback. Acceptable. Acceptable. She had lost more feeling in her ring finger during the operation. The nerve transection from years earlier was degrading further, the dead zone spreading. Her clinical note on the subject was one word. Torith closed the record. Another note from 23 years before death. A Vrelian child, age 4, congenital nerve column malformation that had left the child paralyzed from the thorax down. No Vrelian surgeon would attempt the repair. The columns were too small, the margins too tight, the failure modes too catastrophic. Astrov had operated for 14 hours. The child walked 9 weeks later. Postoperative note, patient ambulatory, column alignment within normal parameters. Note, wrist stiffness in left hand increasing. Entry 3 modification may be approaching mechanical limit. Acceptable for now. Will reassess if surgical precision degrades. She had known her modifications were degrading. She had known they would not last forever. She had kept operating anyway, monitoring the decay of her own engineered capabilities with the same clinical precision she brought to her patients, calculating how long each modification would hold, how much function she could lose before the loss endangered the work. Another note from 4 years before death. A Methely elder nerve cage repair. The most difficult procedure in Astrov's repertoire, 6 hours inside a cage of sensory fibers spaced at 0.3 millimeter intervals, where the slightest uncontrolled hand movement could trigger cardiac arrest. Postoperative note, patient stable, cardiac function restored to baseline, final Methely procedure, hand control below personal threshold for this procedure type. Referring all future Methely cases to Dr. Vurath at the Salesi Institute. She uses the articulated instruments. Her failure rate is 2.8%. Mine would now be higher. Acceptable decision. She had stopped, not because she wanted to, because her modifications had finally degraded past the point where she could guarantee the outcome, and her response was not grief, not anger, not frustration. It was a clinical note. She had measured the gap between her declining capability and the standard her patients deserved, and when the gap exceeded her tolerance, she had referred the work to someone else. The same precision she had applied to the cuts, she applied to the stopping. Torith closed the records. The faculty review convened 9 days later. Torres presented her findings to a chamber of 63 senior surgeons and examiners. She spoke for 2 hours. She displayed the images, the log entries, the suture analyses, the biomechanical models showing how each modification changed the functional envelope of Astrov's hands. She showed the patient outcomes without commentary. She played 6 technique recordings from the data crystal, selecting procedures that covered 6 different species, so the faculty could see Astrov's modified hands at work. The impossible lateral flex of the index finger sliding between Vrelian nerve columns, the absolute stillness during an 11-hour Keth reconstruction, the ring fingers gripping a scalpel with mechanical precision, and no sensation. She read the succession note's final paragraph aloud, in Keth, and sat down. The debate lasted 4 hours. Senior examiner Vothran, 90 years in his position, argued that mounting human remains in a Keth theater violated tradition, implied a standard the Collegium surgeons should not be measured against. Surgeon General Kethis said nothing for 3 hours and 40 minutes, then asked one question. Is there a Keth surgeon in this room who could have matched her outcomes? No one answered. The vote carried, 49-14. On the morning the display was mounted, Torres arrived at the theater before anyone else. The preservation team had finished their work. The hands were sealed in a clear case of Keth optical crystal, mounted above the scrub station exactly as Astrov had specified. Palms down, fingers slightly curled. The 31 scars were visible. Under the theater's bright light, the parallel lines across the knuckles cast faint, hair-thin shadows that made them look like script in a language that could only be read by touch. Below the case, a small plaque. Torres had written it herself, in formal Keth script, following Astrov's instructions exactly. It read, 31. Nothing else. No name, no title, no species, no explanation, just the number. When the first surgical students arrived for morning rounds, they saw the case and stopped. They looked at the hands, small, scarred, obviously non-Keth, obviously old, obviously marked by something deliberate and repeated. They looked at the number. And they asked. That was the design. Torres understood it now. The hands and the number were not an answer. They were a question that would be asked every morning by every surgeon at every scrub station for as long as the Collegium stood. 31. What did you cut away from yourself to reach the patient on the table? What are you willing to lose so that someone else's body survives? How many scars is a life worth? In the weeks that followed, the effect spread in ways that proved Astrov had planned further ahead than Torres had initially understood. Students who asked about the hands were directed to the technique archive. The archive led to the modification log. The log led to the principle, not the specific modifications, which were species-locked to human anatomy, but the methodology, the framework. The idea that a surgeon could study the gap between what her hands could do and what her patient needed, and then close that gap through her own body, using materials sourced from the very species she intended to serve. The first Keth surgeon to attempt an analogous self-modification came forward 6 weeks after the display was mounted. Apprentice surgeon Kelleth, 23 years old, 8 years into practice. She proposed a scoring modification to her secondary gripping digits that would increase flexion range for Vrelian operations, a pattern derived from Astrov's entry 14, translated from human to Keth anatomy using the biomechanical models Torres post-mortem had generated. She presented the proposal formally, using Astrov's documentation format, and included a cost analysis. The modification would sacrifice 8% of her grip strength in daily activities. She listed this in the same flat clinical language Astrov had used, acceptable trade. The Collegium approved. Kelleth performed it herself under local anesthesia, documented in real time. Recovery took 9 days. The flexion gain matched prediction within 0.1 degrees. A second surgeon followed within the month. A third within the quarter. Each adapted the methodology to a different species, a different limitation, a different cost. Each documented the trade in Astrov's format. Each filed the documentation beneath her log in the archive. The lineage had begun. Torith attended the seminars where young surgeons presented their proposed modifications. She sat beneath the display case and listened as they explained what they intended to cut, and why, and what it would cost, and what it would gain their patients. She corrected their proposals when the cost analyses were incomplete or when the suture selections were suboptimal. After one presentation, she approached the young surgeon Aketh, barely 8 years into practice, proposing a modification to serve Vrelian patients. The same species Astrov had begun with, 51 years ago, in a mirror rig, alone. "Your proposed modification," Torith said, "the flexor release in the secondary grip. Astrov's entry 1 used Vrelian nerve silk as the anchoring suture. You have specified synthetic filament." "Yes, examiner, the synthetic is rated equivalent." "It is rated equivalent for standard applications. For operating inside a Vrelian nerve casing, the biological filament has a compliance advantage at body temperature that the synthetic does not match. Astrov chose it for a reason. The reason is on page 4 of her entry 1. The young surgeon looked at her, nodded, amended the protocol. Torith returned to the examination bay. There was work to do, there was always work to do. But as she passed through the theater, she paused at the scrub station. She looked up at the hands, the scars, the number. 31. An ordinary woman had spent 51 years cutting herself open so that her hands could reach inside bodies they were never designed to touch. She had traded feeling for precision, stability for range, comfort for capability, proprioception for reach, and she had done it without augmentation, without genetic modification, without any advantage beyond the stubborn, irrational, magnificent human refusal to accept that the body she was born with was the body she was required to die with. And when she died, she had left the proof where it would do the most good, not in a journal, not in a database. In her own hands, sewn shut with alien thread, mounted above a scrub station in a theater full of surgeons who would look up at them every morning and understand that mastery was not inherited. It was built scar by scar, cut by cut, patient by patient. 31 times she chose the knife. Torith had examined thousands of bodies. She had cataloged the dead and filed their stories where they informed the living and then, eventually, were forgotten. But this body had done what none of the others had done. It had made the collegium inherit from a species it had never considered its equal. And in accepting the inheritance, the collegium had changed not by policy or decree, but by the slow, scar-by-scar accumulation of surgeons who stood at the scrub station, looked up at the number, and understood that the distance between their hands and their patients was a distance they were permitted to cross. Torith lowered her gaze from the display case, turned toward the examination bay, and began the day's work. Behind her, the first students of the morning filed into the theater, saw the small, scarred hands mounted in crystal above the station where they would prepare their own, and paused. They always paused. And then they asked. The questions did not stop. They spread through the collegium like a slow infection, not the violent, destructive kind, but the kind that rewrites the host from the inside, cell by cell, until the organism that emerges is something its original architects would not recognize. Within 6 months of the display's installation, the Collegium's library reported a 400% increase in requests for Terran anatomical references. Surgeons who had spent their entire careers operating exclusively on Keth patients were suddenly requesting comparative anatomy files on Vrelian, Salesi, Metheli, and Drenari nervous systems. The requests came from all levels: apprentices, journeymen, senior practitioners. They came with the same question attached, sometimes written formally and sometimes scrawled in the margins. How did she do it? Torith noticed because the library requests crossed her desk. Everything in the moratory division crossed her desk eventually, the way everything in a river eventually crossed the deepest point. She approved each request without comment. She noted the trend. She did not interfere. But when the first formal petition arrived, a document signed by 31 apprentice surgeons, requesting the establishment of a xenosurgical training program based on the Astrove archive, she set down the instrument she had been calibrating and read it from beginning to end. 31 signatures. She was certain the number was deliberate. The petition was well constructed. It cited the technique recordings from the data crystal, the modification log, the biomechanical analyses from Torith's own post-mortem report. It proposed a 3-year supplementary curriculum that would train Keth surgeons to operate on non-Keth patients, beginning with species whose nervous systems were best documented in the archive. It acknowledged the risks. It acknowledged the costs. It used Astrove's own language, acceptable trade. Torith forwarded it to Surgeon General Kethis without amendment. The Surgeon General's response arrived the following morning. One line: convene the curriculum board. The curriculum board had not convened for a non-routine matter in 11 years. Its 12 members, the most senior surgeons and examiners in the collegium, occupied a long table in a windowless chamber deep in the administrative level. The chamber's walls were lined with preserved specimens of Keth neural tissue, each one labeled with the name of the surgeon who had contributed it upon retirement. 3 centuries of tradition in glass jars. Torith presented the petition. She projected the technique recordings on the chamber's display wall. She showed a Keth apprentice's proposed self-modification alongside the Astrove log entry it was derived from, the original human anatomy, the Keth translation, the biomechanical modeling that bridged the two. Senior examiner Vothran spoke first. He had voted against the display. He had spent 90 years in his position, and his opinion carried the weight of every one of those years. Examiner Torith, I will stipulate the outcomes, I will acknowledge the skill. What I cannot accept is the methodology. He leaned forward. Astrove modified herself, alone, without institutional oversight, without peer review, without safety protocols. She performed surgery on her own hands with borrowed instruments and alien materials, and the fact that it worked does not make it sound practice. It makes it luck that held. 99.7%, Torith said. Over a career, with a sample size of 1 practitioner, we cannot build a curriculum on the methodology of 1 person, however extraordinary. The collegium standards exist because they protect against the practitioners who are not extraordinary. If we teach young surgeons that self-modification is acceptable, we will lose hands. We will lose careers. We will lose surgeons to procedures they perform on themselves before they are ready. The room was silent. Vothran was not wrong. Torith knew he was not wrong, and she suspected he knew she knew. Senior examiner, she said, Astrove's methodology was not reckless. It was iterative. She began with the lowest risk modification, a tendon release that carried a recovery cost of 11 days and a failure mode of reduced grip strength. She waited 9 months before attempting the second. She documented every outcome. She adjusted her approach based on results. She was her own clinical trial, and she ran it for 51 years with a rigor that exceeds most collegium research protocols I have reviewed. She was also unmonitored, Vothran countered. Yes, because no institution existed that would monitor her. She invented the discipline. The curriculum petition proposes to create the institutional framework. She never had oversight, peer review, graduated risk protocols. It proposes to take what she did alone and make it safe to do together. Vothran sat back. His crest, flattened with age to a thin ridge along his skull, twitched once. You are asking us to institutionalize sacrifice. I am asking us to institutionalize excellence. The sacrifice is the surgeon's choice. It always has been. The debate continued for 6 hours. Torith had expected 4. The additional 2 were consumed by a question she had not anticipated, raised by a junior member of the board, Surgeon the Valley, who specialized in pediatric neural reconstruction and who had said nothing for the first 5 hours. The petition references 31 signatures, the Valley said. I contacted 8 of them. Each one told me the same thing. They went to the scrub station. They saw the hands. They asked what the number meant. And then they went to the archive and read the modification log. She paused. None of them mentioned the technique recordings first. None of them mentioned the surgical outcomes first. Every one of them started with the scars. The room waited. The scars are what moved them, the Valley continued, not the skill, not the success rate, the cost. They looked at those hands and saw someone who had paid for every capability with a piece of herself, and they wanted to understand why. That is not a scientific response. It is an emotional one, and I want to know whether this board is comfortable building a curriculum on an emotional foundation. It was the most dangerous question anyone had asked. Torith felt her crest flatten. Surgeon the Valley, she said, choosing each word the way a surgeon chose each incision, deliberate, precise, aware of what lay beneath. The collegium was founded 312 years ago by Surgeon Patriarch Vorenthal, who amputated his own secondary gripping arm after a surgical error cost a patient's life. He did it in the operating theater, in front of his students, and he said the record preserves his exact words. A surgeon who cannot feel the cost of failure in his own body has no business holding a scalpel over another's. The Collegium's founding act was an emotional response to a surgical failure. Every tradition in this room descends from it. She looked at the preserved specimens lining the walls. We ask our retiring surgeons to contribute neural tissue samples. We mount them in glass. We label them with names. We do not do this for scientific purposes. The tissue is too degraded to yield useful data after the preservation process. We do it because the tradition matters. Because it reminds every surgeon who enters this room that the hands that serve the collegium eventually become part of it. She turned back to the Valley. Astrove understood this. She did not leave us her hands because they were scientifically interesting, although they are. She left them because she understood that surgeons are moved by what they see at the scrub station. She placed her hands where they would be seen every morning by every surgeon in the collegium, because she understood that the decision to cut into yourself for someone else's benefit is not made in the rational mind. It is made in the part of the surgeon that looks at a patient and feels the distance between what is and what should be. The Valley nodded slowly. Then the curriculum should acknowledge that. It will. The vote carried, 10-2, Vothran abstained. The Astrove curriculum, as it came to be called, launched 14 months later. 12 apprentice surgeons enrolled in the first cohort. The program was structured in 3 phases: study, simulation, and for those who chose it, modification. Phase 1 was the archive. Every student spent 6 months with the 412 technique recordings, the modification log, and the biomechanical analyses. They studied not just what Astrove had done, but how she had thought. They learned to read her margin notes the way musicians learn to read notation, not just the symbols but the silence between them, the decisions not taken, the alternatives considered and rejected. Phase 2 was the simulation lab, which the Collegium constructed in a converted storage bay adjacent to the primary theater. It contained synthetic tissue analogs for 7 of the 11 species in the archive, each designed to replicate the specific surgical challenges Astrove had documented. Vrelian nerve columns that retracted if disturbed, Salesi cranial tissue that hardened on a 90-second timer, Keth lattice fibers that unraveled at vibration thresholds above 0.02 millimeters, Methylly cardiac nerve cages wired to sensors that triggered an alarm if any fiber was contacted. The students practiced on the analogs for 6 months, using their unmodified hands, learning where their natural anatomy failed and where it succeeded. At the end of Phase 2, each student received a detailed map of their own limitations, not as a judgment but as a diagnostic. A surgical self-assessment, written in the same format Astrove had used. Phase 3 was the choice. No student was required to modify. The curriculum was explicit on this point. Self-modification was a tool, not a requirement. Some limitations could be addressed through instrument design, through technique refinement, through collaborative approaches where multiple surgeons divided the manual demands of a procedure. Astrove herself had acknowledged this in the archive's margin notes. Not every gap requires a cut. Some gaps require a different hand. The skill is knowing which. But some students chose the cut. Apprentice Kelleth was the first. Her secondary digit modification healed clean, and within 3 months she was performing Vrelian nerve column approaches with a lateral reach that exceeded any Keth surgeon's unmodified range. She documented the procedure in Astrove's format and filed it beneath the original log in the archive. Apprentice surgeon Droven followed. He proposed a modification to his primary grip tendons that would reduce tremor amplitude below the Keth lattice threshold. The modification was more complex than Kelleth's. It required a synthetic dampening compound derived from the Keth lattice bonding material Astrove had used in her own fingertip. The irony was not lost on anyone. A Keth surgeon using Keth material to modify Keth hands so they could operate on non-Keth patients. Astrove had used the same material in reverse. The circle was closing. Droven's modification succeeded. His tremor amplitude dropped to 0.013 millimeters below even Astrove's achieved threshold. He performed his first Vrelian procedure 4 months later, and the patient, a Vrelian merchant who had traveled to the Keth system specifically after hearing about the Astrove program, walked out of the collegium with full neural function restored. The merchant's name was not recorded in the collegium's archives, but the merchant's government recorded it. The Vrelian Concord sent a formal diplomatic note to the Keth Dominion 6 weeks later, acknowledging the procedure and requesting information about the training program that had produced it. The note was polite, measured, and buried in its 3rd paragraph was a sentence that Torith read 4 times. The Vrelian Concord notes with interest that the Keth Collegium has adopted a training methodology originated by a Terran surgeon, and observes that this methodology may represent a framework applicable beyond its current institutional context. They wanted it. The Vrelians wanted the Astrove curriculum. Torith forwarded the note to the Surgeon General. The Surgeon General's response this time was 2 lines: respond, and begin preparing the curriculum for export. The preparation took a year. Translating the curriculum from Keth anatomy to Vrelian anatomy was not simple. The 2 species' hands shared almost nothing in common. Keth manipulative structures were 4-fingered, double-jointed, designed for grip strength and rotational precision. Vrelian structures were 6-dendrilled, boneless, controlled by hydraulic pressure differentials in fluid-filled sheaths. The surgical challenges were completely different, and the self-modifications a Vrelian surgeon would need to perform to operate on, say, a Keth patient were unrelated to anything in Astrove's log. But the methodology transferred. The framework assessed the gap, design the modification, document the cost, perform the procedure, evaluate the outcome, iterate was species agnostic. Astrove had not left a recipe. She had left a way of thinking. Torith spent 4 months working with a Vrelian surgical delegation to translate the framework. They met in the Collegium's newly designated xenosurgical wing, a converted section of the Moratory Division that Torith had personally overseen the redesign of, replacing the single-species examination bays with multi-configuration surgical theaters that could accommodate patients of 7 different species. The Vrelian delegation's lead surgeon was a tendril specialist named Serethi. She was young by Vrelian standards, 83 local years, roughly equivalent to Torith's own 40 in Keth terms. She arrived with a delegation of 4, examined the display case in the primary theater for 45 minutes without speaking, and then asked to see the data crystal. Torith granted access. Sarethi spent 3 days in the archive room reviewing the recordings. On the 4th day, she asked to examine the hands themselves. "The hands are sealed," Torith said. "Preservation protocol." "I understand. I'm requesting visual examination only, through the crystal." Torith took her to the theater. Sarethi stood before the display case and extended 2 of her 6 tendrils toward it, not touching the crystal, simply holding them close, the way Avrelian expressed focused attention. "The tendon length redistribution," Sarethi said. "Entry 29. She shortened the flexors of her index and middle fingers by 0.8 millimeters to match Avrelian grip profile." "Yes." "She reshaped her hand to hold our instruments." "Yes." Sarethi was quiet for a long time. Her tendrils retracted slowly. "I have operated on Vrelian patients for 51 years, she said. "I have never considered modifying my own tendrils to serve a non-Vrelian patient, not because I was unwilling, because the thought never occurred to me. The distance between my anatomy and another species' needs was a wall, not a problem." She looked at the same wall and saw a door. She turned to Torith. "We will adopt the curriculum, and we will send our best students here to train." "Here," Torith said, "the collegium was designed for Keth instruction." "The collegium was designed for Keth instruction until 14 months ago. Now it houses a xenosurgical wing, a multi-species simulation lab, and a display case containing human hands above a Keth scrub station. The design has already changed." "Examiner, I am not asking you to accommodate us. I am asking you to let us contribute." The first Vrelian exchange students arrived 3 months later. 4 tendril surgeons, each with at least 10 years of experience, each having reviewed the Astrove archive in its entirety before their arrival. They brought with them Vrelian surgical instruments, Vrelian tissue analogs, and a proposal for reciprocal training. Vrelian modifications that would allow Keth surgeons to operate on Vrelian patients, and Keth-derived modifications that would allow Vrelian surgeons to operate on Keth patients. The cross-pollination was immediate and chaotic. The simulation lab, designed for 7 species tissue analogs, was suddenly too small. The Vrelians worked on a different circadian cycle, requiring the lab to operate in shifts. The instruments were incompatible. Keth surgical tools were designed for rigid digits, Vrelian tools for flexible tendrils, and neither could be used by the other without modifications that themselves required studying the partner species' anatomy in detail. But the work progressed. Within 4 months, the first cross-species modification was documented. A Vrelian tendril surgeon named Kelethi performed a hydraulic pressure redistribution in her secondary tendril that allowed her to generate the rigid point precision necessary to handle Keth lattice bonding instruments. She documented it in Astrove's format, filed it beneath the log, listed the cost, 7% reduction in lateral flexibility of the secondary tendril, affecting her ability to perform standard Vrelian embrace gestures, a social limitation, not a surgical one. Her note read, "I will explain to my family that my embraces are now slightly different. The explanation will take less time than the surgery. Acceptable." Torith read the entry and felt her crest flatten again. The same words, the same clinical precision masking the same fierce, quiet choice. The Salesi Consortium sent an inquiry 4 months after the Vrelian delegation's arrival, then the Metheli Sovereignty, then the Drenari Collective. Each species that appeared in Astrove's archive, one by one, made contact with the Collegium. Each sent surgeons. Each wanted the methodology. The Collegium's primary theater, designed 300 years ago for Keth surgeons operating on Keth patients, was now hosting morning rounds that included 4 species. The scrub station was modified to accommodate Vrelian fluid sheath sterilization alongside Keth dermal sterilization, alongside Salesi carapace joint preparation. 3 different sterilization protocols, running simultaneously, in a space originally designed for one. And above all of it, the hands, small, scarred, human, mounted in crystal, watching. Torith was in the examination bay when the Terran consular attaché requested a meeting. She had been expecting it. The attaché, a young man named Reeves, posted to the Keth system for less than a year, sat across from her in the bay's consultation alcove, visibly uncomfortable on the Keth-sized chair. Examiner Vasani, the Terran consulate has been following the developments at the Collegium with great interest. I expect you have. Dr. Astrov's bequest has exceeded what the consulate anticipated. When the succession note was filed 14 years ago, the expectation was that the hands would be preserved and studied. A memorial, essentially. The consulate did not anticipate a curriculum, a xenosurgical wing, or a multi-species training program. Neither did I, Torith said. Reeves leaned forward. The consulate would like to send surgical observers, human surgeons, young ones, to study the curriculum and determine whether it can be applied in Terran medical institutions. Terran surgeons studying a curriculum derived from a Terran surgeon's work, taught in a Keth institution, to Keth, Vrelian, Salesi, and Metheli students. Torith considered the circularity. Astrov would have found that efficient. Will you accept them? Torith thought about it for exactly as long as it took to realize she had already decided. Send them, but understand what they will find. This is not a Terran program. It is not a Keth program. It is something that did not exist before Astrov's hands arrived on my slab. It belongs to no species. It belongs to the work. Reeves nodded. He stood and then paused. Examiner, there is one other matter. The consulate has been contacted by Dr. Astrov's family. Torith's secondary eyes focused. She had family. A daughter, Tessara Astrov. She is a structural engineer on Brevery, the colony where Dr. Astrov was born. She has requested permission to visit the display. She does not need permission. The theater is open to all Collegium visitors. She is human. Humans are not Collegium visitors. They are now, Torith said. Tessara Astrov arrived on a transport from Brevery 3 weeks later. She was tall where her mother had been small, broad-shouldered where Lien had been narrow. She had her mother's gray eyes and none of her mother's stillness. She moved through the Collegium's corridors with the restless energy of someone who built things rather than repaired them. Her gaze cataloging structural details the way a surgeon cataloged anatomy. Torith met her at the theater entrance. They stood for a moment in the doorway, the bright light washing over them both, and Tessara looked up at the display case. She was quiet for a long time, longer than Serethi, longer than the students or the faculty or the delegations. She stood beneath her mother's hands and looked at them with an expression Torith had not seen on any of the hundreds of faces that had stood in that spot over the past 2 years. It was not reverence, it was not awe. It was not the clinical fascination of a surgeon or the diplomatic interest of a delegate. It was recognition, the look of someone seeing something they had lived with for decades, finally displayed in its true context. She couldn't button her coat, Tessara said. Torith waited. The last 10 years, she couldn't button her coat in the morning. The ring fingers, she couldn't feel the buttons, and the left wrist wouldn't bend enough to reach the top button. She used a hook tool. She designed it herself. A little curved thing, titanium, with a grip shaped for fingers that didn't have full proprioception. Tessara's voice was steady. She had tools for everything, opening jars, tying knots, holding cups. She designed each one the way she designed her surgeries, precise, elegant, specific to the problem. She had a whole drawer of them. I did not know that, Torith said. She didn't put it in the log. The log was about the gains. The tools were about the costs. She kept them in separate drawers. Tessara paused. She kept everything in separate drawers. The surgeon in one, the mother in another. I think she believed that if she mixed them, the compromises would show, and she couldn't afford compromises. not in the operating theater and not at home. Was she? Torith searched for the right word. Human emotional vocabulary did not translate cleanly into Keth. Was she present, as a mother? Tessara looked at her. She was present the way a surgeon is present, focused, attentive. Precise. She knew exactly where I was in my life at every moment. She could tell me what I was struggling with before I told her. She noticed everything. Another pause. But she couldn't hold my hand properly after I turned 12. The modifications had progressed too far. She held it differently with her thumb and index finger because those still had full sensation. The grip was clinical, like she was holding an instrument. Something flickered across her face. I didn't understand until I was much older that it wasn't clinical. It was the best she could do with what she had left. Torith's crest flattened so hard against her skull that it ached. She said nothing. There was nothing to say that the silence did not say better. Tessara turned back to the display. She told me about this, years before she died. She said she was leaving her hands to the Collegium because the Collegium was the only institution in the known galaxy that would understand what they were. She said humans would see a sacrifice. The Collegium would see an engineering project. She wanted them seen by engineers. We saw both, Torith said. Tessara nodded. Good. She would have hated being pitied, but she would have hated being admired without being understood even more. She reached into a bag she had carried from the transport and produced a small case. Inside were 17 objects tools, each one handcrafted from titanium and surgical-grade polymer, a button hook, a jar gripper, a knot-tying aid, a cup holder with a proprioceptive bypass grip. Each one designed with the same precision Torith had seen in the modification log, the same elegant specificity, the same ruthless functionality. These are the costs, Tessara said. She kept them in the drawer on the left side of her desk. The modification log was in the drawer on the right. I am giving you the left drawer. She set the case on the edge of the examination slab. Put them next to the hands, not below them, next to them. She would have wanted them at the same height. The costs and the gains side by side. That was the truth of it. Torith took the case. She opened it and looked at the 17 tools. Each one was a small, precise answer to a problem created by a previous small, precise answer to a different problem. Each one was a scar's shadow, the daily, domestic consequence of a surgical choice made years or decades earlier. A button hook because a wrist modification had sacrificed flexion range. A cup holder because a nerve transection had sacrificed grip feedback. A knot-tying aid because a tendon-length redistribution had made the finger's natural resting grip asymmetric. Together, the tools told the story the modification log did not. The log documented what Astrov had gained. The tools documented what she had paid. I will place them as you specified, Torith said. Tessara looked at the hands one more time, then she turned to go. Your mother, Torith said, did she have any regret? Tessara stopped at the doorway. She did not turn around. I asked her that once. When she was 76, she was sitting at her desk using the button hook. I asked her if she would do it again, all 31. A pause. She said she would do 32 if there were a 32nd species that needed her, and she said it while hooking her top button because she couldn't reach it with her fingers anymore, and she did not see the contradiction. Because to her, there was none. She left. Torith placed the tools in a secondary crystal case, mounted at the same height as the hands, as specified. She wrote a second plaque in formal Keth script. It read 17. 17 tools, 17 costs, mounted beside 31 scars and 31 gains. The students who arrived at the scrub station the next morning paused longer than usual. They looked at the hands. They looked at the tools. They looked at the two numbers. And the question changed. It was no longer just what did you cut away. It was also what did you build to live with what was left. The answer, Torith realized as she watched them file into the theater, was the same for both questions. You built what was necessary. You built it with precision, with specificity, with the ruthless clarity of someone who understood that every choice had a cost, and every cost required a tool, and every tool was proof that the choice had been worth making. Years passed. The collegium changed and kept changing. The Astrove curriculum expanded to include 12 species. The xenosurgical wing grew to occupy an entire level of the complex. Cross-species modification protocols became standardized, reviewed, peer-evaluated. Everything Vothran had demanded, built on the foundation he had feared. The first generation of Astrove-trained surgeons graduated 4 years after the curriculum launched. 12 had entered. 9 completed the full program. Of those 9, 6 chose self-modification. 3 did not, opting instead for instrument-based approaches that the curriculum had validated as equally legitimate paths. All 9 were operating on non-Keth patients within a year of graduation. Their combined success rate across the first 50 procedures, 97.2%. Not Astrove's 99.7%, but higher than the Collegium's own 94%, achieved by surgeons who had trained for less than 4 years in a discipline. Astrove had spent 51 building alone. The 3 who did not modify themselves proved something Toreth had not anticipated. Surgeon Peleth, who had spent Phase 2 documenting her limitations with Astrove's rigor, but had decided the costs of modification exceeded what she was willing to pay, developed a collaborative surgical protocol for Vrelian nerve column procedures. 2 Keth surgeons working in synchronized tandem, each handling half the manual demands, neither requiring the extreme lateral flexibility that Astrove had purchased through her wrist modification. The protocol worked. It was slower 14 hours where Astrove would have completed the procedure in 11, but the outcomes matched. Peleth documented it in Astrove's format. Her cost analysis read, 3 additional hours of surgical time, 0 permanent anatomical compromise, trade acceptable for my circumstances. Other surgeons may calculate differently. That is the point. Toreth read it and realized that Peleth had understood something about the curriculum that even Toreth had not fully grasped. The inheritance was not self-modification. The inheritance was the thinking, the rigorous, honest assessment of the gap between capability and need, followed by the disciplined search for a way to close it, whatever form that closure took. Astrove had closed it through her own body because she worked alone, in an era when no institution supported her, with no colleagues trained in her discipline. Her students had options she never had. The fact that they used those options differently did not diminish the methodology. It proved the methodology was robust enough to survive its own generalization. Vothran died 4 years after the display was mounted at 94, and his neural tissue was preserved and mounted in the curriculum board's chamber alongside 3 centuries of predecessors. But his retirement note, filed the year before his death, contained a line that Toreth kept in her personal archive. I was wrong about the methodology. I was right about the risk. Both things are true. This is the nature of progress. The Terran surgical observers came and studied and returned home and built their own programs. The Vrelian conquered established a sister curriculum. The Salesi Consortium funded a joint research initiative. The Drenari Collective sent its first surgical exchange. Students, 6 bone surgeons who spent a year learning to operate on species, whose nervous systems ran through soft tissue rather than through skeletal structures. An anatomical difference so fundamental that the required modifications were among the most radical anyone had attempted since Astrove herself. One of the Drenari students, a young bone surgeon named Varathi, proposed a modification so extreme that the curriculum review board debated it for 3 weeks. She wanted to partially decalcify a section of her primary drilling appendage, reducing its bone density by 18% in order to create a flexible zone that could navigate the curved neural channels of a methylly cardiac nerve cage without the rigidity that caused Drenari instruments to crack the channel walls. The cost, permanent structural weakness in her primary tool limb, requiring her to wear a support brace during all non-surgical activity. The review board approved it 7-5. Torith cast the deciding vote. Varatha's modification succeeded. She performed her first cardiac procedure 6 months later. The patient survived. Varatha's drilling appendage, braced and slightly bowed, where the decalcification had thinned it, held position inside the nerve cage for 4 hours without deviation. Her documentation note read, "Primary appendage structural integrity reduced, brace required for daily function, surgical precision within target parameters. The brace weighs 0.3 kilograms. The patient weighs 312 kilograms and is alive. Acceptable trade." Torith read it and smiled, the Keth equivalent, a slight widening of the secondary eyes and a softening of the crest. The language was Astrove's. The precision was Astrove's. The voice was entirely Varatha's own. That was the inheritance, not the specific modifications, which were unique to each surgeon's anatomy and each patient's needs. Not the technique recordings, which were bound to Astrove's particular hands and particular era. The inheritance was the thinking, the framework, the refusal to accept that the distance between one body's capabilities and another body's needs was anything other than an engineering problem to be solved at the engineer's own cost. Torith retired from the collegium 18 years after Astrove's hands arrived on her examination slab. She was 67 old for a Keth examiner, though not as old as Vothran had been. Her crest had thinned to a pale ridge. Her primary eyes needed magnification assistance for close work. Her secondary eyes still tracked well. On her final day, she followed the tradition of all retiring examiners. She entered the primary theater at dawn before the students arrived and stood at the scrub station for the last time. She looked up at the display case. The hands were unchanged. Preserved in crystal, sealed against time, they looked exactly as they had the morning she had first pulled back the drape in Bay 7. Small, scarred, slightly curled. The 31 lines across the knuckles still cast their hair-thin shadows in the theater's bright light. Beside them, the 17 tools gleamed in their secondary case, the button hook, the jar gripper, the knot-tying aid, each one still as precise and elegant as the day Tessara had brought them across the stars. Torith looked at them for a long time. She had examined thousands of bodies in her career. She had filed their stories where they informed the living. Most had been forgotten, as most stories were absorbed into the archive, referenced occasionally, eventually superseded by newer findings. That was the nature of the Moratory Division's work. The dead informed the living, and then the living moved on. But these hands had not been forgotten. These hands had changed the institution that housed them, the species that studied them, and the definition of what a surgeon could become. They had done it not through force or decree, but through the quiet, persistent pressure of a question asked every morning at every scrub station, by every surgeon who looked up and saw the number. 31. Torith placed her hand, her four-fingered, unmodified examiner's hand, flat against the crystal case. It was not a gesture the Keth used. She had seen Tessara do it, years ago, standing in this same spot. A human gesture, a touch without contact, a way of reaching across a barrier that could not be crossed. She held her hand there for 3 heartbeats. Then she lowered it, turned toward the examination bay for the last time, and walked through the theater as the first students of the morning filed in behind her. They paused at the scrub station. They looked up at the hands. They looked at the tools. They looked at the numbers. And then they asked. They would always ask. That was the design. That was the inheritance. That was the 31st modification, the final one. The one Astrove had performed not on her hands but on the future itself, cutting away the assumption that species were islands, that anatomy was destiny, that the distance between one body and another could not be crossed by sheer, stubborn, ordinary will. It was the deepest cut, and it had healed the cleanest.